Good morning. It is 11 o'clock, so we'll go ahead and get started with today's Rock County Public Health Department media briefing. I want to welcome everybody. Thank you for joining us today. This briefing is being streamed live on our Rock County Public Health Department's Facebook page. It will also be uploaded to our YouTube page once the briefing is completed. We'll be hearing some COVID-19 updates from our panelists first, and then we will open it up to questions from the participating media. I'll now turn it over to Nick Zupan, our Rock County Public Health Department epidemiologist, for some data updates. Go ahead, Nick.
Thanks, Jessica. So just a brief overview of some of the metrics that we're taking a look at. We've had just over 14,000 Rock County residents test positive for COVID-19 over the course of this pandemic. 96% of those who have tested positive have recovered from their illness. Right now, we're estimating that there is about 364 active cases out in the community right now. And looking at our most recent trends, we're averaging 27 new cases per day over the last week. There have been 148 deaths due to COVID. And yesterday we had 19 patients in the hospital getting care for COVID-19. Our hospitalization numbers have hovered around 20 for the past couple weeks now. In terms of our vaccine numbers, we have had over 20,000 individuals in Rock County receive the first dose of the vaccine, which is about 12.3% of our total population, and 6,474 individuals have gotten that second dose, so that's about 3.9%. We are starting to see increases in our 65 and older population who are getting that first dose of the vaccine. Right now, over 10,000 adults who are 65 and older have gotten the first dose of the vaccine, and that's about 36% of the total population in Rock County that is 65 and older. Only about 934 65 and older adults have gotten that second dose, which is 3.3% of that population. So we're starting to see an increase in those who are getting that first dose, and we're waiting to see that same increase in those who are fully immunized. All in all, the case data and the new cases that we're seeing continues to drop. We're seeing good trends there where we're seeing lower and lower case activity. Unfortunately, we're still seeing kind of leveling off or a plateau of our hospitalizations. So we're seeing anywhere from kind of 17 to 24 patients in the hospital on any given day getting care for COVID-19. So we're still seeing relatively high levels of patients needing care for COVID. Otherwise, the data is looking very good. So with that, I'm going to turn it back over to Jessica.
Thanks, Nick. So now we will go to Kelsey Cordova. She is one of the Rock County Public Health Department supervisors, and she will be talking about the DHS community vaccination site in Rock County. Go ahead, Kelsey.
Thanks, Jessica. We are honored to announce that the Wisconsin Department of Health Services has chosen Rock County to host the first community vaccination site run by their contracted vendor, AMI Expeditionary Healthcare. You may have seen the governor's official announcement earlier this week. The site will be hosted at the Blackhawk Technical College main campus. DTC was an ideal candidate given their experience hosting the recent week-long National Guard vaccination site, and because their facility has sufficient storage space to accommodate initial shipments, as well as any future needs should they arise. We are working in partnership with AMI Expeditionary Healthcare to coordinate implementation of the clinic. We have been hard at work to orchestrate the logistics to get this up and running as seamlessly as possible. The Rock County site will open February 16th, taking appointments from Tuesday through Saturday, 11 a.m. to 7 p.m., with the ability to vaccinate up to 250 individuals daily. If Wisconsin's vaccine allocations increase, the goal is to provide up to 1,000 vaccines per day. 6 to 10 additional community-based vaccination sites will open across the state as needed, and as the vaccine supply will allow. AMI will coordinate with local public health departments to meet unique needs of each community. This community vaccination site will be a regional site, meaning that it is primarily for Rock and surrounding counties, but that it's open to anyone who lives or works in Wisconsin and is currently eligible to be vaccinated. The goal of this site is to increase access to the vaccine. A community site helps ensure much broader access, and this is especially important for those who are not already connected to a healthcare system. For example, the uninsured or individuals who do not have an existing relationship with a healthcare provider who would be reaching out to schedule a vaccination. In addition, although the vaccine is free of charge to everyone, providers do have the option to charge an administration fee for the vaccination. There will not be any administration charges for the community clinic at Black Hawk Technical College. The site will take patients by appointment only. Patients who are eligible and encouraged to register include healthcare workers, first responders, including police and fire, and individuals age 65 and over. A link to register for an appointment at this community site is coming soon. There will also be a phone number for people who are not able to register online. Please watch for an announcement from the Wisconsin Department of Health Services, followed by information on the DHS and Rock County Public Health Department websites. In the meantime, those who live or work in Rock County are encouraged to continue using the registration forms located on the Rock County Public Health Department website, or to call 608-352-6727. Anyone who has participated in the National Guard Clinic for their first dose of the vaccine and has an appointment for their second dose do not need to do anything further at this time. Those appointments will be honored by AMI. Turn it back over to you, Jessica.
Thanks, Kelsey. So we'll now open it up to questions from the media. You can raise your hand if you have a question. If you are joining us by phone, *9 will raise your hand, and *6 will mute and unmute your phone when you're called on. So it looks like right away we have a question from Adam Duxter with News 3 Now. Go ahead, Adam.
Hey guys, can you hear me all right?
Yes, we can hear you.
Awesome, cool. 2 questions today, and I'll make them quick. The first is, do you know now when the vaccination site opens on Tuesday, roughly the number of allocated vaccines that'll be coming to the county every week, at least in terms of what the state will be promising, just kind of numbers that you'll see kind of coming in each week? And then secondly, I wanted to ask about Mercy Health. I know they made it aware yesterday that they did not receive their normal vaccine shipment. They're supposed to get roughly 2,000 vaccines, and they didn't get them from the state and still haven't got them. I don't know if you've been made aware of this, but if you have, just kind of what you know, and if you're working with them to try and get the vaccines they need. So just those 2 questions. Thanks, guys.
Do you want to go ahead and take the first one, Rick?
Sure, I can try to answer that for you. The allocation next week is 1,000 doses for the clinic at Black Hawk Tech. So as Kelsey indicated, that they're capable of giving up to 250 a day, but the true allocation is 1,000 for next week. On that, we're anticipating that allocation to be fairly flat until the vaccine supplies can increase. Although the second week we will be administering the people that received that first dose in the Black Hawk Clinic a couple of weeks ago. So that'll be in addition to the 1,000 new doses. As far as the Mercy, I don't have any specific information on Mercy's allocations. In general, the state of Wisconsin has a limited supply that they're given by the federal government. We have more and more providers throughout the state that are able and registered to give vaccines. So the state supply is remaining relatively flat for vaccine doses, but the number of doses that each individual provider are receiving have been going down because there's more providers throughout the state. So I don't have specific about Mercy's numbers.
Okay, thanks, Adam. Next question will go to Ashley McCallum of the Janesville Gazette. Go ahead, Ashley.
Hi, everyone. Can you hear me?
Yes, we can hear you.
Excellent. Thank you for having us all here again today. I have 2 clinic-related questions for you. The first being, will the state-run clinic be pulling people off of the county's already existing registration form, or will those individuals need to register again separately if they wanted to go right away to the state clinic? And then secondly, do you have any more insight yet on why the state chose Rock County to be its first clinic? I think a lot of people are kind of scratching their heads over that. It seems maybe a little random. And, is it because we did not have any plans for a public option for the vaccine right off the bat? Anything you could speak to that would be great. Thanks.
Sure. Oh my goodness. So I focused on the second question and forgot the first. Jessica, Ashley, can you help me out again?
Go ahead, Ashley.
Okay, great. The first question was, will the state clinic be automatically reaching out to folks who are already registered through Rock County's registration form, or will people who have registered through that form need to register separately with the state if they wanted to, pursue services through them?
Sure. Thanks so much. My apologies. The Rock County Public Health Department will help coordinate and facilitate some of that connection. So when additional information is provided about how to register for the community-based vaccine clinic through AMI out at Black Hawk Technical College, we will be reaching out to those who've registered on the Rock County Public Health Department's forms and are currently eligible for a vaccine, and passing along that information to them so they can schedule their appointment at that clinic. And then for your second question, which I do remember, is about why Rock County was selected as a pilot site. And I do know the governor had mentioned a couple of the reasons yesterday. So while we don't have specific information related to all of the factors that went into selecting this pilot site, and we do know that there are additional community sites just like this one going up across the state as a vaccine supply does allow. We do know that DHS evaluates various socioeconomic factors in selecting sites in an effort to serve the largest number of those in the greatest need, so that everyone has access to the vaccine if eligible. So the Rock County area and surrounding counties, we do have a large number of uninsured and underinsured residents, and access to this community-based clinic really does increase their accessibility to the vaccine because many of them aren't connected with a primary healthcare provider.
I might want to follow up a little bit on that, Kelsey. And what Kelsey said is exactly right. And another reason is the timeliness question. And I think our ability to show that we had a site and a great partnership with Black Hawk Tech already in place, and the state wanting to get these up and running as soon as possible, that we were positioned very well to make this happen quickly.
Great, thanks for the question, Ashley. Next question, we'll go to Austin Montgomery of Beloit Daily News.
Hello, can you guys hear me okay?
Yes, we can hear you, Austin. Sorry, go ahead.
Okay, thanks. Just wanted to kind of reiterate kind of the points that the governor touched on yesterday. We've had some questions about it. Would you just basically be able to explain kind of that emphasis on reaching people who are underserved or uninsured and why that's so important for being able to move forward here with rollout?
Sure, I can provide some comment, and then rest of the team, feel free to jump in. So I think, it's important to be able to increase access to the vaccine and primarily, really emphasize the availability of appointments to people who are uninsured or underinsured at this community-based vaccine clinic, because start by saying this is one of many vaccine provider options in the state of Wisconsin. So healthcare providers, doctors and hospitals, along with pharmacies and some other health-related systems, have access to the vaccine to be able to provide it to their patients. So those with insurance and already have established connections to the healthcare systems have more opportunities to get their vaccine. So those that don't have insurance and maybe don't have a regular healthcare provider have limited access to the other vaccine provider options. So it's really important that these community-based clinics reach those that have less options to get their vaccine. Anybody else have anything to add to that?
Yeah, so we have a vaccine advisory committee in Rock County that is looking to make sure that we're advocating for and developing strategies to ensure the equitable access to the COVID-19 vaccination services in Rock County. And so this community site is just a wonderful opportunity for those in the community and the region to be connected, just like what Kelsey said, for those people that might not traditionally be plugged into a healthcare system. So it's just another way to reach the community so that we can vaccinate in an equitable manner.
Great, thank you, and thank you for the question. Next, we will go to Elise Romas from NBC 15 News. Go ahead, Elise. Elise, if you're talking, you might be muted. Go.
Hey, sorry about
Go
that.
ahead.
Issues. I had a question that kind of went with Adam's that he asked first. I'm wondering, we talk about that vaccine supply, maybe not necessarily getting smaller, but being spread a little bit more thinly across the state. Is that going to be a concern when you guys open this site, that you might not have as much supply as you need, and then it might not be as effective as we all hope it will be?
I think vaccine supply is a concern for all vaccine providers across the state. This community-based clinic has the capability and the capacity to serve many more people than just the 200 to 250 a day that we're going to start out at. So I think, knowing that we could be vaccinating more had we had more vaccine, it's a concern for everybody. And I think, Mercy and other healthcare systems locally and statewide are experiencing this same concern. We have the capacity to do more if we just had more resources to do it. But getting vaccines in arms, at whatever rate we can, as quickly as the supply allows, is good regardless. So I think this community vaccine clinic still will still be effective and efficient and accomplish the mission of getting Wisconsinites vaccinated.
Great, thank you, and thanks for the question, Elise. And now it looks like Austin Montgomery from Beloit Daily News has another question. Go ahead, Austin.
Yeah, thanks. Just a follow-up question. Will the vaccine clinic coincide with testing? Is there going to be any impact there? Is there going to be a shift on scheduling for testing? Just wanted to make sure that we could get some information out there about how the testing at Blackhawk Tech would continue or be stopped through the vaccine clinic. So thank you.
Yeah, that's a great question. So while both the Blackhawk testing operation that's been out there since the fall and the new community vaccination clinic will both be operating at Blackhawk Technical College, they will both be operating separately and simultaneously. So the vaccination clinic should not have any impact on the operations of the testing site.
Thanks, and thanks for the question, Austin. Now, Ashley McCallum, Janesville Gazette, another question. Go ahead.
Yeah, so I wanted to start talking a little bit, moving forward in a couple weeks here, the state is expecting to open up eligibility to a few more groups, and these groups are a little bit broader in scope than the groups we've been looking at now as far as vaccination. So as we move forward and we move towards that March 1 date for that, how will the county health department, the state-run clinic, local providers, how is that going to what's communication going to look like for deciding who vaccinates which eligibility groups, or how and who reaches out to certain groups or workplaces? Can you give a little insight, I guess, on what planning is being done to really make sure everyone's getting reached out to, the broader and broader these eligibility groups get?
Allison, do you want to take this one?
Sure. Yes.
Okay, go ahead.
So we do know that the March 1st is coming up rather quickly, and that we're still vaccinating the current eligibility groups. We are waiting from information from Wisconsin DHS, where they're at when that March 1st opening could occur. And so we meet with all different partners in Rock County community to kind of provide information to them on a daily basis if new information is coming forward. So we have a Rock County Emergency Operations Center that meets also, and that's where we plan, organize, and operationalize how these future groups will be reached out to. So there's more to come onto that. We are definitely talking about it internally, and we can provide more information to the public going forward as it comes available.
Great, thank you. Next question, Adam Dexter, News 3 Now. Go ahead, Adam.
Hey, sorry guys. One last follow-up to the two questions that I had asked originally. I want to respect your time, so I'll make it quick. I know, Rick, you had said that in terms of answering the question about supply for the county per week, you kind of mentioned what it would be at the Blackhawk Tech site. But what I'm curious to answer is when you add that to, the doses that Mercy Health gets every week, the doses that SSM gets every week, the doses that Beloit Health Systems gets every week, how many doses are coming to the county total in terms of getting everyone in the county vaccinated per week? I don't know if that's a number you had when you can combine all those. And then the second one being, I know you mentioned with Mercy Health getting 0 vaccines instead of their usual 2,000 this week. I know you mentioned obviously supplies are down in some capacity, but to go from getting 2,000 to 0 seems like more than just a supply issue. I didn't know if there's anything specifically as to why they got none instead of their normal 2,000 this week.
Yeah, as far as the number of doses, the state has a formula for how those are allocated, and they haven't given us a lot of specifics about exactly what that formula is for each county or each provider. Part of it is population based. Part of it is the underserved in each county and in each community, and the counties and the providers' capabilities. The clinic at Blackhawk will not come from will not reduce the number that would go to anybody else in Rock County. The state is basically using these state regional sites from the statewide allocation, not from Rock County's allocation. So although it could affect us in a very minimal way, it won't affect us in a large way because it's coming off the state allocation, not anything for Rock County. As far as Mercy's numbers, I do not have any specifics. I don't know if anybody else does. I'm not aware if their supply was 0. I do know that they have been vaccinating people at least with second doses. I just don't have any specifics about what they did or did not receive. I'm sure their allocation was reduced. I don't know if it was reduced to 0 for new doses, but I do know they have been giving vaccinations at their site, but whether that's just second doses, you would have to consult with Mercy on that, I guess.
Great, thanks. Do we have any other questions? Okay, looks like we have another question from Ashley McCallum, Janesville Gazette. Go ahead, Ashley.
Great. Sorry, I want to be cognizant of your time, but I did want to touch on this a little bit. I understand the state is looking to kind of eliminate what it has up to this point called its phase approach, and I think that really just means kind of a shift in communication. Do you have any insight on how that changes then moving forward as far as changes in eligibility moving forward? Can we expect more of an approach kind of like with the March first group that says, okay, these people who are maybe considered 1B might be eligible as of that date. Is that how we're going to move forward? Or have you gotten any insight from the state on what they mean by kind of shifting their plan with the phasing?
Yeah. Sorry, Allison, you can go ahead.
Okay, yeah, so the phases used during the initial state vaccine eligibility communications was found to be somewhat confusing at times. So going forward, you are likely to hear more about eligible groups versus numbered phases. As soon as we know which groups the state has identified to follow, the healthcare workers, first responders, and individuals over age 65, we will let you know.
Thanks, Allison, and thanks for the question, Ashley. Do we have any other questions from our media partners? Nope, doesn't look like we have any other questions. So we will conclude the media briefing at this time. Thanks for your participation, and I want to thank everyone who was watching on the Facebook live stream. If anyone from the media would like to participate in this media briefing in the future, you can send an email to media.publichealth@co.rock.wi.us, and we will send you the information to participate in this media briefing. Otherwise, these briefings are broadcast live on the Rock County Public Health Department Facebook page, and they will be uploaded to our YouTube page after the briefing. So thanks again, everyone. Be safe and be healthy.